Childhood maltreatment increases risk for personality disorders during early adulthood by Jeffrey G. Johnson et al. So in this study, data from a community-based longitudinal study were used to investigate whether childhood abuse and neglect increases risk for personality disorders during early adulthood. Psychosocial and psychiatric interviews were used from a community sample of 639 youths and their mothers from 2 different counties in the state of New York. Evidence of childhood physical abuse, sexual abuse, and neglect was obtained from the New York State records and from self-reports. Persons with documented childhood abuse or neglect were more than 4 times as likely as those who were not abused or neglected to be diagnosed with personality disorders during early adulthood. Childhood physical abuse, sexual abuse, and neglect were each associated with elevated personality disorder symptom levels during early adulthood, after other types of childhood maltreatment were controlled statistically. Different types of childhood maltreatment were associated with symptoms of specific personality disorders during early adulthood. Therefore, persons in the community who have experienced childhood abuse or neglect are considerably more likely than those who were not abused or neglected to have personality disorders and elevated personality disorder symptom levels during early adulthood. Childhood abuse and neglect may contribute to the onset of some personality disorders.
In this study, they used 639 families with children between the ages of 1 and 11 years from 2 counties in northern New York State, were representatively sampled and interviewed in the 1975 and re-interviewed in 1991 to 1993. Under the assessment of personality disorders, interview items used to access early adulthood PDs in 1991 to 1993 were drawn from the parents and youth versions of the Diagnostic Interview Schedule for Children, the Personality Diagnostic Questionnaire, and the Disorganizing Poverty Interview. Personality disorder diagnoses were assigned to people who met DSM-IV diagnostic criteria, as reported by either the youth or mother. Adolescent personality disorder symptoms predicted early adulthood Axis 1 disorders and suicide. Personality disorder symptom stability when the participants were adolescents were similar among adults in the community. Under assessment of childhood maltreatment, official data regarding child maltreatment was obtained from the New York State records. For confidentiality issues, participants were only identified by numbers, and data was entered by people who had no sort of access to any of the participants' information. Self-reports were obtained from the offsprings in 1991 through 1993. Participants were asked a multitude of questions before the age of 18 about either school, family, or relationships.
Assessment of parental education and psychiatric disorders and childhood temperament. Maternal and paternal education were assessed in 1975, 1983, 1985 to 1986, which was during the maternal interviews. Low parental education was found in 28% of the families. 4 instruments used to assess the parental psychiatric disorders include the Hopkins Symptom Checklist, 90 Anxiety, Depression, and Interpersonal Difficulty subscales. Parental alcohol and drug abuse, the lifetime parental history of trouble with the police, and the lifetime parental history of psychiatric disorders. These 4 instruments were also administered during the maternal interview. If significant emotional problems, substance abuse, or trouble with the police were present in either parent in 1975, 1983, 1985 to 1986, then parental psychiatric disorders were known to be present as well. With these procedures, the lifetime prevalence of parental psychiatric disorders was 38%. There was no trouble if the mother couldn't provide further education or psychiatric disorders. Thus, only the information of the mother was used. Dimensions of childhood temperament assessed during the 1975 maternal interviews include the following: clumsiness, distractibility, non-persistence, non-compliance, anger, aggression to peers, problem behavior, temper tantrums, hyperactivity, crying demanding, and moodiness. If children experience one or more of the anterior dimensions, he or she would be identified as having difficult temperament. Results: in the 639 families, there were 31, 4.9% documented cases of childhood maltreatment, including 15 cases of physical abuse, 4 cases of sexual abuse, and 23 cases of neglect. Also, 58 persons with self-reported childhood maltreatment and 86 youths were diagnosed as having personality disorders. The results showed that persons with documented childhood abuse or neglect were more than 4 times as likely as those who were not abused or neglected to be diagnosed with personality disorders during early adulthood, after age, parental education, and parental psychiatric disorders were controlled statistically. Results also show that childhood physical abuse, sexual abuse, and neglect were each associated with elevated personality disorder symptoms. Different types of childhood maltreatment were associated with the symptoms of specific personality disorders during early adulthood.
To conclude, the results show that persons with documented childhood abuse or neglect were 4 times more likely to those who did not report any to be diagnosed with personality disorders. Therefore, childhood abuse and neglect may contribute to the beginning of some personality disorders. There are strengths and limitations to this study. Some of the strengths are that the sample was representative to the population and it was a longitudinal design. Another important strength to this study is the use of official records of childhood abuse and neglect and the retrospective self-report conducted by extensively trained and supervised interviewers. This study also investigates whether childhood maltreatment predicted personality disorder symptoms after controlling for parental psychiatric disorders. Even though the diagnosis interviews were not given to the parents, they were assessed by using measures of parental problems with the police. The limitations to this study are that other variables can influence personality disorders. For example, maladaptive parenting rather than childhood maltreatment may increase the risk for personality disorder. Another limitation is that most of this evidence is based on retrospective reports by psychiatric patients. Even though research has supported the validity of retrospective reports of childhood maltreatment, to infer from retrospective data alone that childhood maltreatment increases the risk for onset of personality disorder is problematic. Until empirical research demonstrates that persons with documented childhood maltreatment are an increased risk for personality disorders independent from other risk factors, it cannot be established that childhood maltreatment plays a role in the onset of personality disorders.